common question in everybody's mind. What is the purpose of a life? Why are we here? What is the actual purpose of life we are born into?
Let us simplify things for the understanding. So now you said, okay, self-realization should be a goal of all the human beings' life.
So our ancient texts and Vedas has always explained that the purpose of life is self-realization. We need healthy body, healthy mind, and a right spirit to direct body and mind towards ourselves, to know what we are. Actually, I have finished my BHMS and then completed my homeopathy. Later, I was married into the family where traditional medicine runs in their inheritance.
You are trying to understand the cause, from where it is originating.
Actually, this is not a completely new procedure which we are doing. It is just that we are first trying to understand the patient. We are first trying to understand the disease, what led to the disease.
Hi, welcome to KC Talks. Today we have a doctor with us. Her name is Dr. Nirlepa. I don't know what is the kind of treatment that they are giving, but I have a personal experience which I want to share with you people. Post-COVID, I had severe gastritis issues. I was also very afraid during the COVID. I've been eating a lot of diets that people were following. I was taking zincovites, I was taking vitamin C, vitamin D, because people have told that you have to boost your immunity. So in the due course of boosting my immunity, I have really taken probably it was an overload of supplements, and then too much of citric acid in the form of lemon juice, in the form of Mosambi, oranges, and so on. Suddenly, after 5 months, I started having bloating, severe bloating, and then I had anything that I eat, it wasn't getting digested, and I was passing particles like that through the stool, and I didn't understand. Then finally in 2021 I got COVID. I was admitted in the hospital. I took remdesivir and all, whatever treatment was available, because it was peak of COVID. Everybody was afraid during that time. Post recovery of my COVID, my gastric symptoms increased more. Again I started going to allopathic doctors. Then they were giving me Pandy, they were giving me antacids basically, but nothing was giving me relief. Then I switched to homeopathy. Homeopathy was a good relief, but only if I take that, then my digestion was a little better. But then definitely the absorption wasn't great either in that. 2022, I landed with her without knowing what is the nature of treatment that she is doing. They checked something called as pulse, which I have no understanding of what pulse is, but they checked pulse. And then she diagnosed it as some amadosha, some name called amadosha, which I don't understand either. And my pravrutti of the body, the nature of the body, is some pitta vata. So I have no idea. After taking their medicine for almost 8 months, I'm healed. I can eat anything now. So I was very afraid to eat paneer. I was very afraid to eat rajma, all high protein diet. Now I can eat high protein diet and I'm at ease. So I don't know what they have done to me. So let us understand what is the nature of medicine that they are doing and what is their practice, what is naadi, so on and so forth. Namaste, madam.
Namaste.
So thank you so much, Nirlepa ji, to heal me. But I'm doing this typical this podcast with you to understand how did you heal me? What is your understanding about a disease? And what is Nadi? So what have you done to me? I want to know about this, and I want viewers to also understand this new treatment process or procedure. I don't know what to call this.
Actually, this is not a completely new procedure which we are doing.
Okay.
It is just that we are first trying to understand the patient. We are first trying to understand the disease, what led to the disease, which is very important.
Okay.
It is very common habit of today's life to just see the superficial things or things which is manifested to our physical eyes or what we suffer at the higher, the superficial level. We don't try to understand why that happens.
You mean root cause?
Root cause, the process which led to this.
Okay.
Generally, when patients visit to our clinic, they say, I was healthy absolutely till now. Suddenly this happened. Nothing ever happens suddenly. Our body is completely in a process, in a harmony, and something which deviates it from its nature, from its own nature, or disturbs this harmony leads to the symptoms which they suffer now. It is just that they notice it at the latest or the stage where the problem is completely on this expressive level.
Okay, let me ask you this. When somebody comes to you and says, we were fine all through this while,
Yes.
but suddenly we got this. But it is in an experience that it suddenly only happens, no?
That's what, sir. Basically, we need to understand nowadays the patient and the doctors and everybody, human, has lost our roots.
Okay.
See, when we do an experiment, we always have aim. What is the aim? Right, sir. So now we are leading a life. So there is a common question in everybody's mind. What is the purpose of a life? Why are we here? What is the actual purpose of life we are born into?
Okay.
So our ancient texts and Vedas has always explained that the purpose of life is self-realization.
This is getting into a philosophy class now.
No, it's not a philosophy class. It
Okay.
is a basic class which everybody needs to understand. I can explain it to you, I can relate it to you, how I am relating it to the general thing.
Okay, let me understand
So, self-realization.
this. Okay.
Now, in order to attain this self-realization, we need healthy body, healthy mind, and a right spirit to direct body and mind towards ourselves, to know what we are.
Oh,
Without knowing what we are, without knowing what our body is, we are just going away with the life or with the time.
okay.
So we have always tried to understand or based our treatment on complete harmony which is needed to attain this purpose of life.
Okay.
So in order to attain what we are or to what this purpose has to be done, this path is laid by what we call as yoga.
Oh.
See, the problem is we always divide this. We have a nature to become compartmentalization. We compartmentalize things. We always say this is yoga, this is philosophy, this is that, this is this. Actually, this is not the way. We have to see that it is all linked up.
It is all integrative.
It is all integrated. That is, we have to understand.
So
Yoga
medicine
and Ayurveda are integrated part of the system.
Okay.
Yoga is not something philosophy or which is out of it. It is the way to lead our life to serve the purpose of what we are born.
Oh.
And Ayurveda is not the system which I am talking about, the academical system which is developed or which is divided right now. By Ayurveda, I mean the vast knowledge that is mentioned in the Vedas. I do not refer here with the therapy systems that is academically divided right now, to be clear. So that Ayurveda always tells us the science of leading a life.
Madam, it is too heavy for me. So let me just understand. You said no compartmentalization.
Yes.
So this is yoga. For a modern person, when you say yoga, I remember Ramdev Baba. This is yoga. This is yoga asanas.
Yes.
Or I remember some yoga teacher who would have trained
Yes.
me to do some Surya Namaskaras. This is yoga. And when I say Ayurveda, what comes into my mind is Kotakkal, Vaidhya, some, or SDM. So this is what. So you are telling that yoga, Ayurveda, philosophy, realization of life, all are one.
They are linked up.
Okay.
We have to, as a person, we need to understand what to take at what stage of life and what to attain the purpose of life.
Okay.
Otherwise, at any stage of life, there will be some incompleteness.
Okay.
So Ayurveda is the science which helps us to understand how to get a healthy body and healthy mind. So that we can utilize this in a right spirit to attain what we are.
Okay.
To understand at least what we are.
Now you're talking
So
all this
yoga
about self-realization,
and
right?
Ayurveda are integrated.
Okay.
I'm talking about the path that is needed for fulfilling the purpose of life. And in that, it is very important to have healthy body and healthy mind.
Okay.
Now, to have that, what do we want? How to do? What are the principles that needs to be followed? Has been given in the Vedas.
Okay, so as a layman, let us only take about healthy mind and
Yes.
healthy body.
Now we will understand that what
Because
is healthy body
self-realization
and
to me is actually
Yes,
a
of
very
course.
broad spectrum. So we will leave off self-realization to our
Yeah,
next
but
level.
it was very important to tell because we have to think deep.
Okay.
Whether it's a patient, whether it's a doctor, or whether it's a human. We have started, this was always been our roots, where everybody used to know what we are for. Everybody used to thrive for what we are for, at least. Now this has been detached. That's why we see so much increase of diseases, so much increase of the quality of life that was led in the past has been decreased compared to now.
Madam, I have a doubt. So is it like, so now in my generation at least, I see some people who are trying to understand self-realization, so spirituality. They might take different paths to understand their self. But are you telling me that in the past everybody was spiritual and everybody was in the mode of self-realization?
Spiritual was not a different subject to talk about.
Okay.
Now we are making it, that's what I said, now we have become compartmentalized. We are trying to put everything into different system. We are never thinking about as a whole, the holistic approach or the holistic way of leading a life. Whether we come from the educational system or anything. I strongly feel that it is definitely important to have pioneers or specialists in each field, but at the same time we need to understand the link between the subjects, the link between the systems, because the final purpose of each medical system is for the benefit of the people. That is for whether it is homeopathy, whether it is Ayurveda, naturopathy, etc. The compartmentalization has been done for ease of learning.
But in application, you have to apply all in whole.
If we can understand and link all together and then use the right system at the right time, then definitely the overall therapy or overall benefit of the patient would be achieved easily. So that is what our center does.
Okay.
So we have started the center. Actually, I have finished my BHMS and then completed my homeopathy. Later, I was married into the family where their traditional medicine runs in their inheritance.
Okay.
So they had vast knowledge about herbal medicine, homeopathy applications, and Ayurveda, Marma therapies, etc. My husband also had deeper insights about yogic concepts. And also other Vedic sciences from his guru who was into a parampara called Maha Siddha tradition.
Okay.
So it is one of the very ancient yogic traditions where they treat both body and mind in equally. I mean, there is, for any cause, both body and mind are responsible.
Okay. So, madam, let us simplify things for the understanding. So, now you said, okay, self-realization should be a goal of all the human beings' life. Only a person who is striving for self-realization can can understand this holistic,
I will not say only that, but nowadays this has been an increased awareness. If you can see that there is integrated approach coming up, all kinds of doctors are going for this. I'm just trying to tell you that we have to understand that there is interconnectedness and there is we have to see the things in a holistic way.
Okay, good. So now we'll come to healthy mind and healthy body.
Yes.
So you told you come in a tradition, your practice of medicine comes from a tradition called
Maha Siddha tradition.
Maha Siddha tradition.
Yes.
Okay.
So this is also not the Siddha system of medicine. It is just a tradition from which we have placed our philosophy of treatment.
So basic Siddha, like I know, as a, if we are all normal, we are not doctors like you. When you remember Siddha, we think it is a Tamil.
That's why I wanted to
Tamil
clear. It is not Tamil. It is not English. It is just a yogic system of Bharat, ancient yogic system of Bharat. There were 3 systems, out of which Maha Siddha system is one of the tradition where the practices and the principles based on which we treat are from this type of tradition.
So what are the other 2 systems?
Siddha tradition and Achala tradition.
Oh. So total 3.
Major
3. So what are the? One is Achala, one is Siddha,
Maha Siddha.
And Maha Siddha. Siddha and Maha Siddha are different.
Yes.
These are the traditional healing.
No, it is a traditional yogic tradition.
Yogic tradition. Okay, so you come in that yogic tradition.
My husband comes from that, and I learned from him,
Okay.
which changed my total outlook and approach, and we started seeing things in an integrated way, and we started developing this way of approach in our clinic, because why we could understand your disease, or to understand a person or a disease, we need to know we have to link him up to understand. We have to see him in an integrated approach, rather than just seeing your symptom, where it is, on which system, why it is happening. And for that, this naadi helps. This also
Okay.
comes from his guru.
So let me summarize again my understanding to you. So Maha Siddha tradition of what you follow,
Yes.
it doesn't do a symptomatic healing.
It is not a healing system, sir. It's a yogic system. The
No, no,
philosophy is carried from
no,
it.
no, got it, madam. So it's a philosophy,
Yeah.
but what you are trying to do out of that is you are not doing a symptomatic treatment. You are trying to understand the cause from where it is originating, and to understand that cause, you are using pulse as your diagnosis. Is my understanding right?
Yes, yes.
Okay. So now let us get into. So pulse is your basic diagnostic parameter.
Yes, we use the pulse as the major diagnostic tool. And as you are mentioned, like in Mahasiddha tradition, there is one sect of Ayurveda Hridaya. From that, this philosophies of healing developed.
Oh.
So because that's a yogic path.
Hmm.
Because to attain the self-realization, we need healthy body and healthy mind. The importance of Ayurveda comes. The importance of how to lead a life comes. Science of leading life is nothing but Ayurveda. Now, in that there are many sects. Out of that, Ayurveda Hridaya is the basic set which we have developed, and we have started our therapeutic principles on.
To my understanding, Ayurveda Hridaya is part of the real Ayurveda.
Yes.
There
is no real and unreal Ayurveda. There is Ayurveda, the Vedic knowledge.
Ayurveda
Yes.
text.
Yes.
Some samhitas and bhagas.
Yes.
That is how so Ayurveda Hridaya is part of that only.
Yes.
And in your school of thought, you have emphasized, or you have chosen Ayurvedic Hridaya as your healing.
Yes.
Is my understanding right, madam?
Yes. That is based on the principles of that Ayurveda Hridaya, we have developed our therapeutic principles. How to treat, how to see a patient, the approach, how we should do for a treatment.
And for the treatment, you are using pulse to understand his problem.
Yes. Pulse helps us to understand the deeper level of a person. That's why we also use pulse. Majorly it is pulse, and also we consider all the modern techniques which we go through. We definitely link everything. That's what I'm trying to say from the beginning. We do not neglect anything. Neither we deny anything. We just try to connect, interconnect. That is what is integrated approach about.
So do you connect modern medicine also?
Yes, of course.
Allopathy also?
See, modern medicine, allopathy, yes, the function, dysfunction, everything comes under that. That's what I'm saying. Till we are still compartmentalizing, saying this is allopathy, this is not allopathy, this is your body. This is especially compartmentalization in nature of in life sciences will not work completely. We have to see, we have to link up and stop. In fact, I would say like this is that, saying that. We have to understand that this is our body. This is our liver. See, our body is the best example to work as an integrated approach.
Okay.
When your right hand has got fractured, your left hand try to compromise and do other things. Your right hand and left hand are different from one another, but their main purpose is to do the work for the whole body. It doesn't mean that this is opposite to this, or the principles are different, or whatever. Finally, they are different, they work different, but they work for a same purpose.
Okay, I understand.
So especially in case of life sciences, it is very important that we integrate, we have an integrated approach, and we try to understand the interconnectedness, and right time, right treatment is the main point.
Superb. I understood something as whatever little my brain can understand, because it looks like it's a vast knowledge. So these are all layman questions.
Yes.
A person who has very basic understanding of medicine. Do you consider modern diagnostic, parameters, like your different tests?
Yes.
Either it is an LFT or it is a kidney function
Yes.
test. Do you also consider this modern diagnostic parameters in your healing, in your treatment?
We consider.
You consider.
We consider.
So you're taking that modern treatments of all different diagnostics.
It is just a lab diagnostics.
Yes.
And I don't think it is, we have anything to neglect about it. We can consider this as we diagnose or we understand the patient. I would say I understand the patient.
Understand.
I definitely consider the diagnostic tests.
Okay. So now
along with the pulse, and I try to link those things.
Okay. So can I ask you a straightforward question? When you touch a pulse of a person,
Yes.
can you also understand through that there is something abnormality with his functioning of a liver or functioning of a kidney?
Yes,
So,
we can understand.
You can understand. So you're using this diagnostic parameters to just, connect the dots. Like
Yes.
in order to check if your analysis is right and going in the right direction or not.
True. Yes, because it is always important. See, if you are growing a plant, it is very important to, it is just enough if you just plant, water the roots. No need to water each leaf or no need to look after each leaf. If you give the right nourishment at the root, the whole tree develops in a healthy form.
Wonderful, ma'am. Then in my case, specific to my case,
Yes.
so I had some bloating issues, some burping issues, some indigestion problem.
Yes.
But modern, I don't have any modern equipment to tell me what exactly my problem is.
Yes.
Because, I have done my endoscopy, that is what you can do, right? You go to a gastroenterologist, he will give you antacids for some time, and then if it is still going on, he would do an endoscopy and check, whether everything is normal or not normal. And in endoscopy, nothing came out. But I had issues, I had symptoms.
Yes.
So what did when you touched my pulse, what is it that you understand out of it? You understood out of that?
First thing, before explaining this, I would like to tell a simple thing. Symptom or the suffering or the lab diagnostic tests are the final product of what the whole disease has started, the process. That's why I wanted to explain importance of the harmony between a healthy body, healthy mind and the spirit.
Okay.
When this harmony gets disturbed, which we say as disharmony, that leads to some disorder in the body. There has been an order before, now this has been disturbed. Now that disorder leads to dysfunctions.
Madam, what is spirit?
Spirit is just a force, right force to put your body and mind towards the direction.
So it's
right directional, yes.
It's like Trinity.
Trinity, yes.
Okay, so healthy mind, healthy body and the spirit.
Right spirit.
If they are in a right order, I am healthy.
Harmony.
If they are in a harmony, that's what? Harmony. If they are in a right...
Harmony is very different from the order.
Okay.
Harmony is when one change, the others also change according to that.
Okay.
And now the question would be how this harmony should be there.
Yes.
And that depends on your constitution, Prakriti.
Oh.
The basic individualistic or unique Prakriti.
Okay, so let me summarize it. If healthy body, healthy mind and the spirit are in harmony, then I am supposed to be healthy person.
In harmony with your constitution.
In harmony with my constitution, then I am an healthy person.
Yes.
If this is not in harmony and it is not with my constitution, if things are not going, and what is constitution mean? My question is that.
Constitution, the whole world is made up of, or the prapancha, I could say, is made up of 5 major elements. Earth, water, fire, air and ether, or space or ether.
Panchabhutas.
Yeah. Panchabhutas, yes. Now they are made in different ratios. According to Ayurveda, they have major 3 principles in the combination of these 5 elements. Air and space together form Vata. It's a vital principle which maintains our body. Pitta is the fire element, major fire element. The Kapha is a combination of earth and water.
Okay.
Now, in simple terms, Vata is the principle of momentum. Pitta is the principle of metabolism or change, anything to change. And Kapha is the principle of secretions.
Secretions. All secretions are under Kapha.
Now, everybody we all are born, during the time of conception, our constitution is determined based on the ratio of this Vata, Pitta and Kapha.
Time of birth.
Yeah. Conception, not birth.
Conception, okay.
When the zygote is about to form, at that time, we base it on the constitutions of our parents during that time.
Oh.
So it's a different complete science which we would which is would be a
No,
completely
it
different
looks like
branch
it's
to understand.
so it looks like it's a massive
Yes.
science. But okay, so the Trinity, the healthy mind, healthy body, and the spirit should be in a right harmony,
Yes.
and they should be in harmony with your
Constitution, which we call as Prakriti.
Prakriti. So then, if they are in that space, then you are healthy.
And
If
then
anything,
we can, yes, and when we start deviating from our Prakriti, which is we call as Vikruti, then we start getting into disorder. This disorder then leads to dysfunctions in the body. From the certain stage of dysfunctions, the lab diagnostic tests can diagnose some things. Finally, the dysfunction leads to some dis-ease. Dis-ease. The ease is lost in our body.
We are not at ease.
Yes. That we express as symptoms, or the other persons understand as signs.
So in order to translate it to a disease, there is some incubation time.
Yes.
So my Prakriti, my constitution, and all this Trinity should lose their harmony, and then all this development happens, and after a certain time you get a disease, and that's where you find it in the diagnostic reports.
So you are understanding the disease at the final stage. I mean, you asked me the question like why all of a sudden, because you have known the symptom at that time only. Before the process is not, you are not able to identify in your body.
Then that means we are lost in touch with our real self.
That is what we want to explain, that pulse helps us to understand to some extent. That's where the pulse diagnosis plays a very important role. And in order to understand your constitution, the first step we could understand, that's why that nothing was coming in your diagnostic, because it was at the function dysfunction.
Okay, ma'am, let me understand this again. As an analogy, my case study will be an analogy to the viewers to understand. I had digestion issues.
Yes.
I kept on using antacids. Nothing worked out for me. Then the doctor finally did an endoscopy and said there is nothing. There's nothing to worry. You please go on continuing on antacids, but you should also be little meditation. You should decrease your stress and so on and so forth. He just told me philosophy class. The gastroenterologist was a good man. He said and he also told me this, that this is just for a temporary relief of antacids, but I don't want you to be get used to the antacids. He was good man, at least he told me that, because there are people who are using antacids for years together.
Yeah.
So what went wrong in my case, and when did it go wrong, and how did
See, when it did go wrong, that you have to analyze, but we can tell you what went wrong.
Okay.
Ama dosha is something where you take, in your case especially, it indicates toxin, the toxin that has been undigested. See, when you eat something, or when you have your metabolism going on in your body, it should be in a proper way so that the nutrition is absorbed. At the same time, it is equally important to excrete the toxins out. And in order to excrete it out, that is also has to be transformed into a simpler form. We just cannot say like I will eat this and that will be excreted. That transformative principle should be healthy enough to transform it into the last stage and excrete it in the form of urine, sweat, or fecuses. When that transformative principle has some disorder, then the toxins will not be excreted out. They start getting deposited in your body.
And that is called ama.
Ama dosha.
Ama actually means indigested food, is it?
It's not only indigested food, any kind of toxin which has not been completely eliminated.
Oh, it's a toxin that is not even eliminated.
One of the reason is food. Disease leaves some toxins, bacteria leaves some toxins, viral toxins, viral toxemia, that's what the modern medicine call it as. So there are many. That is again I am telling, ama dosha itself is.
So you saw my pulse first, and then you told me.
So first it is an ama dosha. Because it was always pitta that had imbalanced in you. It was not pitta vata that was imbalanced for you, it was pitta kapha for you.
Okay.
So you didn't have the capacity to eliminate the toxins out of the body because of the imbalance of the transformative principle or the Agni principle, that is pitta.
Oh, okay.
And it also indicates that your absorption rate is very low. So the whole problem is not present in the stomach, but it is present in the gut.
Okay.
And that's why we started treating your gut first, rather than taking the stomach as your major point of view. because
Great.
you said like you have bloating and all, and at the same time what happens is your issue didn't develop because of hyperacidity. It was hypochloremia for you.
What is hypochloremia?
Reduction in the production of HCl.
Reduction in the production of stomach acids.
Stomach acids, stomach enzymes. Because of that, and why do you get then burning sensation is the next question which generally comes up. So what happens there is when the acid levels and enzymes are getting low, the food does not completely digest before it passes off.
Yes.
When it doesn't get digested, it starts producing the gases. And that is the burning sensation which you are getting. It's not because of HCl. It's because of fermented food.
Okay.
You are getting your burps and HCl problem.
And when it comes to gut, what is the issue, madam?
In the gut, the right biome was not developed. Actually, in the gut, there needs to be beneficial bacteria. There is beneficial bacteria. There is opportunistic bacteria. And there are harmful bacteria. It is always there because our gut is continuously in exposure with the external environment, whatever food we eat. But the ratio has to be maintained. 90% should be more of beneficial bacteria and 5-10% will be always of harmful and opportunistic bacteria, which will be maintained by our immune system. When this balance is lost, then you develop your gut symptoms. And that's what happened with you.
Great. So all this you could understand only through pulse?
It helped me to understand through pulse, yes.
Great. And that's how you gave me probiotics at the first place. And then you gave natural probiotics like kefir.
Yes.
And then kombuchas and apple cider vinegar and all of that.
Apple cider vinegar was to balance your HCl.
Okay.
At that, and the probiotics and prebiotics were for your gut.
Great. You have a very good modern understanding, madam. Because as a doctor, whenever I met you, we never went so deep into what was going wrong.
Yes.
You just told me that, yeah, you have a gut issue. You start taking probiotic pills and you gave some probiotic pills also. Great. So, as a principle, you could understand there is an ama dosha from looking at the pulse, and then you summarized and you interpreted in a way that, it should work from me, and that is how you have treated me.
So, basically, we work on major 3 principles. One is individualistic. Every person is individualistic in his prakriti. We have to understand his prakriti and how his disease has been individualized. As your prakriti is individual, so is your disease. So is the process of your disease. Individualistic. Second basic principle, look at the person in a holistic way. It's not only the body that gets disturbed, it is also the mind. That's why the gastroenterologist asks you to reduce your stress levels.
Okay, now one important point in all of this. Healthy body you told, gut you told, HCl you told. What is role of mind here and how did it translate?
Gut is the second brain of the body. And it is directly related to your mind because the neurotransmitters that are produced in the gut and the brain are related.
Okay.
And we generally say in our common language, this is our gut feeling.
Yes, we say that.
So any emotional imbalance which is there in the body or any imbalance need not be named or diagnosed. Okay. Like I'm upset today or I'm nervous to perform anything. Best way we can see is in the case of anxiety. If they want to go for a new situation and they are feeling anxious, they definitely go for 2-3 times they go for washrooms.
Yes. That's IBS, right?
Yes. No, that's what I'm saying. We are always interested in terming the name. That which is not important actually. It is important, but not at this stage. We have to understand it is a dysfunction. The mind is triggering his body to go to the motion. We are irritating our gut to get into the motion because of our anxiety in the mind. So the mind and the body are related there.
So in my case, mind had what? Anxiety or fear?
It was more of fear and stress, which we could do. Stress is a very big and common term which is used nowadays. But yes, it was more of fear, which we had to. Very could be which is unknown fear. That's what we say. We do not know from what we are fearful about, but we have that anticipation in the body.
But once I got my gut healed, madam, I have lost fear also. Yes,
because the neurotransmitters and the healthy gut helps you to heal your mind also. But these are two interconnected. That's what I want to say. See, if you give a kid, now we are doing some autism cases. If you give him directly daily sugar, the kid would be hyperactive. How is sugar and hyperactivity related would be the question. So your kid would continuously making him having sugar and chocolate will increase his inflammation in the gut, and he will always be active in the mind because the serotonin levels which are produced in the gut and the melatonin levels in the brain will be imbalanced. the whole neurotransmitter things will get imbalanced.
Okay, now we understood at least in this healthy mind, healthy body. So here mind, because it is all gut problems. But if it is a kidney problem or a liver problem or any another, or probably a
Yes.
bone problem, also there is a mind connected
Yes,
to this?
because our body and mind are interlinked. Many
Okay.
emotions which we face or which we feel daily have their negative impressions on our body.
Oh,
That study is what we call as psychosomatics, and recently the modern medicine is developing the link called psycho neuro endocrino immunology. That means
no, one second. Psycho, neuro, endocrino, immunology. Okay.
immunity,
Okay.
endocrine system,
That is because for hormones, right?
nervous
Endocrino.
system, nervous system,
Uh-huh.
and mind are
Oh.
linked up. And there are many cases where because of stress autoimmunes gets triggered.
Oh,
So mind and body are very much connected.
wonderful session, madam.
So it is very important for us to understand a patient in a holistic way,
Mm,
to see him as an individual,
mm.
and our approach should be an integrated way. That is the major principles which we do in our center.
What I've understood in this session is how mind, body are interrelated, and how from mind the any kind of disorderly function in the body is translated.
Yes.
And once your body is getting healed, it is also translating to your mind.
Yes.
And then we understood about the doshas.
Yes.
And all this should be in a harmony with each other. And then we understood that if they are not in harmony, after a certain point of time, it will translate as a disease.
Yes.
Great. So all this is finally boiling down to looking at pulse and understanding the prakriti of a person.
Yes. No, that is also three things are needed. We need to understand the individual. We need to understand how his process has been developed. For that, we need to see the person as a whole, holistic view.
Okay.
Third, give an integrated approach. What is needed, when is needed, based on that, we have to give.
Superb, madam. Very knowledgeable session. Though I have used your medicine for more than a year, but I could only understand, the grassroots level problem and your understanding of what is malfunction in my body. Very good insight. I'm very thrilled to listen to all of this. So what we'll do is, madam, so we'll end this with pulse, because we have understood your philosophy, your theory, your understanding of a disease, and finally it is boiling down to pulse. So let us understand in the next podcast what is pulse, what are doshas, and though you told me superficially that
yes.
during the formation of the zygote the prakriti is formed, so we will understand the pulse and pulse parameters and its healing procedures of what you do, madam.
Sure.
Thank you so much for giving time.
Namaste.
Namaste.